The flu pandemic was a recent and horrible memory for people in Weymouth in 1922. So it's not that unlike our current time. The difference is there was no treatment for flu then. We do have drugs for the flu, but other very common infectious diseases that were lethal in 1922 and untreatable, pertussis, streptococcal infection, pneumococcal pneumonia. Measles was among the top causes of death in 1922. Pneumococcal pneumonia was common and commonly lethal, but they knew that there was something about the blood of people who'd survived pneumococcal pneumonia that could help to treat other people with pneumococcal pneumonia. They thought that it had an antitoxin in it. Now, these days we know that that's an antibody as part of the immune system. Now, what's interesting is in the beginning of the COVID pandemic, there was a notion that we could use convalescent plasma from people who'd survived COVID to treat other people who had the infection. Now, it turns out that the convalescent plasma was not as effective as the drugs we have, so we stopped using it. But it's interesting, sometimes there are cycles in history. So we went from using convalescent plasma to treat a lethal pneumonia in 1922, and we were using it again in 2020 to try to treat COVID pneumonia. Most infections are treated at home. The patients who are hospitalized for infections are usually the elderly who are less able to fight off infection, or people who have particular infections that are overwhelming, COVID being probably the most significant example. Measles and pertussis now treatable with a vaccine, or preventable with a vaccine, and all these other pneumonias and other infections manageable with antibiotics. And antibiotics didn't come along really until the mid-1930s, and it was really after the Second World War that we had penicillin, streptomycin, and the sulfa drugs, a real panel of antibiotics to give people. If you get an infection in your finger after cutting yourself gardening, chances are you're going to take a few doses of a drug that your physician prescribes and you're going to be fine without having to go to the hospital.